Mental health careers are absolutely necessary in this day and age to help people who are in need and to combat the stigma of mental illness. If you have an interest in psychology, a natural empathy for people, and the ability to listen, then a career as a mental health counselor could be the right choice for you. Keep watching. Mental health counselor. Before you consider the steps to becoming a mental health counselor, it's important to know what's expected of you during an average day. Some people may just need support as they navigate the stress of their busy lives, while others will need to be diagnosed with mental illnesses. Others may need to talk to someone in order to discuss complex childhood trauma. Mental health counselors will usually assess clients on their first visit through a questionnaire. Then they'll spend the rest of the session talking about the issues the person is experiencing and what they wish to get out of therapy. It's important that both the patient and the counselor is on the same page. You'll also find that there are specific issues that you can specialize in. For instance, a therapist that works predominantly with couples wouldn't be prepared to properly help a person that has an eating disorder or who needs rehabilitation from substance abuse. Typical day. On a typical day, mental health counselors need to encourage their clients to be open about their thoughts, feelings, and history. By actively listening and taking detailed notes so that they remember the progress they've made each session, counselors provide educated insights that allow their clients to grow. Collecting. Counselors need to document information about their sessions, either during or immediately afterward, in order to keep track of their clients' progress. They also need to fill out client-related paperwork such as diagnostic records and federal or state-mandated paperwork. Assessing. Counselors also need to use their best judgment when it comes to assessing whether a client is a suicide risk or not. The Suicide Resource Prevention Center provides resources to help counselors decide whether clients are suicidal or not. If a counselor does believe a person is a suicide risk, it's recommended not to leave that person alone. Empathizing. Last but not least, counselors need to be able to empathize with their clients. Empathy is the ability to put yourself in another person's shoes or to relate with another's emotions and thoughts. Karkoff's 5-point scale is used to measure a therapist's ability to empathize with their patients. If a therapist is at level 5, they're able to understand and also respond to their client in a way that provides insight without adding bias. Interpersonal skills. Along with a natural sense of compassion and empathy, mental health counselors need to have good interpersonal skills as they'll be working with people of all kinds of backgrounds. They need to be able to develop relationships with their clients and build trust. Listening skills. Counselors need to have good listening skills. More importantly, they'll need to read between the lines and be able to interpret their clients' words, moods, and behavior in order to get a good reading on how they're feeling. Active listening is especially important. It allows a counselor to fully understand what their client is saying, but also convey to their client that they're in a safe place and that they're being heard. InterCoast Colleges provides vocational and trade school programs that can help kick off your career through the development of technical skills, professional attitudes, interpersonal communication skills, and more. Take a look at the certificate programs that InterCoast Colleges offers today. And if you enjoyed this video, be sure to like, comment, and subscribe.